We all strive for more happiness, joy, and meaning in our lives, but we often get caught up in the day-to-day stresses and busyness. How can we overcome our negativity bias and choose mindful practices that open our hearts, foster gratitude, and help us live with purpose? My guest today is an expert in developing personal resilience through evidence-based techniques that rewire our brains for positivity. He'll share simple yet powerful routines we can build into our daily lives to boost happiness and overcome the chronic stress of our times. Get ready to gain more joy as we discuss the intersection of mindfulness, neuroscience, and spirituality. You won't want to miss this inspiring conversation on creating an upward spiral of gratitude in your life. Hello and welcome to the Over 50 Health and Wellness Show. I'm your host, Kevin English. I'm the founder of The Silver Edge, and our mission is to help you build and maintain a lean, healthy body that you love for the rest of your life, so that you can show up in the second half of your life as the healthiest, strongest, most vital version of yourself. We have a great show for you today. Dr. Greg Hammer is here, and he's going to help us reconnect to gratitude and joy in these tumultuous times. If you're someone who grapples with negative self-talk, anxiety, or depression, stick around. This is a conversation you don't want to miss. My guest today is Dr. Greg Hammer. Dr. Hammer is a professor at Stanford University School of Medicine. He's a pediatric anesthesiologist, and he's a mindfulness expert. He's the author of Gain Without Pain, the Happiness Handbook for Healthcare Professionals. Dr. Hammer has lectured globally on physician wellness and teaches the GAIN method to students and residents at Stanford. His clinical work focuses on pediatric cardiac anesthesia and critical care, while his research covers developmental pharmacology and immunology. And as you'll hear today, Dr. Hammer is an expert on gratitude, and he embraces health and meditation practices utilizing mindfulness and non-duality principles. I started our conversation today by asking Greg how he got interested in the subject of gratitude.
That's a good question, Kevin. You know, I've been a long-time wellness enthusiast. My undergraduate degree is in nutritional science. I've been a long-time physical fitness enthusiast, long-time meditator, a bit off and on until about the last 10 years. And I've been studying Advaita Vedanta since that time and going on spiritual retreat. I have one next week. And I joined our Well MD group at Stanford about 10 years ago, a newly convened group in order to address the growing prevalence of burnout among physicians. And that's been a huge problem. And we have identified what we think are the main drivers and also some of the solutions. My interest has been in the area of personal resilience, which is not a complete solution to burnout. We also have to address the culture in the workplace and efficiency in our practice. We can get into that if you'd like, but basically my interest is in personal resilience. So I was asked to give a talk on behalf of WellMD to a national group of hospital administrators several years ago, and then another talk. Then I had some sabbatical time and I decided to write a book. I'd sort of distilled down what I think are the four pillars of happiness into four essential elements. And they're certainly not of my own device. They are embraced by all, essentially, as far as I can tell, religious and philosophic traditions. And they include gratitude, acceptance, intention, and non-judgment. And so those four pillars form the acronym GAIN. And that was incorporated into the title of my book, Gain Without Pain. And so, after thinking about it a lot, I studied Buddhism, really had a hard time remembering a lot of Sanskrit words, but also remembering the 10 steps of this, the 12 ways of that, or even Deepak Chopra's 7 essential ways. And so I thought 4. 4 is a number that I'm down with. I can remember 4 things and come up with an acronym for 4 things. And gratitude was really at the fore, and we can get into that. So that's maybe a long answer to your question about how I got into the importance of gratitude, but it's sort of intrinsic to happiness. And if we just look at our empiric experience, we can see that gratitude is an essential component to happiness. For example, we can imagine, or we may know somebody who's poor and happy, or perhaps physically challenged and happy, but it's hard to even imagine somebody who's ungrateful and happy. So I think that's a way of looking at the importance or the essential nature of gratitude with respect to happiness.
All right. So I want to pull apart a bunch of that, especially that relationship between gratitude and happiness. But I want to back up a minute. I'm kind of fascinated by this concept of personal resilience you had mentioned. And I suppose this came out of your work specifically in the medical field, but I think we could probably apply this across the board a little bit. So when you say personal resilience, what are you talking about? What in that is fascinating to you? And how do we as individuals incorporate that maybe into our lives practically to become more
Yes, of course.
resilient?
I mean, that's what it's all about. So, again, just to kind of step back, burnout, which is sort of what got me involved in this wellness movement, if you will, in the hospital setting and in the medical school setting, and then well beyond that. Burnout is really just the mental and physical exhaustion that we experience related to chronic stress. And I heard a wonderful talk yesterday by a family doctor who has done a lot of time thinking about and being involved in burnout and its remedies. A lot of people describe burnout as sort of a complicated thing in stages. First, there's stage A, then B, then C. I just try to keep things really simple because that's what my mind can get around. And that's what I think I can convey in a short conversation, basically, or a 1 hour talk. And burnout being the manifestations of chronic stress brings us to what is stress. What is acute stress? What is chronic stress? So, again, I'm giving you a long answer to your question, but about personal resilience, I think we have to sort of look at the 30,000-foot view of what is resilience and why do we need to have it? Why can we all develop it? Acute stress is often adaptive. I mean, acute stress is a series of physiologic responses to a threat. So people often give the example of, you're running away from a predator. But I get acutely stressed when I go to the gym. And so what is that acute stress? Well, it's activation of several hormones in the body, and they include the hormone adrenaline, as the English call it. We call it epinephrine, but most people know it as adrenaline. So adrenaline obviously is a chemical that causes our heart rate and blood pressure to increase, causes our blood sugar to increase as well. So our heart is doing more work, it's pumping more blood, and it's pumping blood with a higher concentration of glucose. So this is exactly at least one ingredient that is adaptive if we're running away from a predator or even preparing to engage in exercise or engaging in exercise. I have a continuous glucose monitor on. It's a little patch that goes on the arm here, and I wear it occasionally for 2 weeks at a time. And this one's about to expire any minute now because it's been on for 2 weeks. But I'm curious as to the influence of things that I eat and activities on my blood sugar because I want my blood sugar to remain in a stable, relatively low range. I noticed just getting out of bed in the morning, we do have a little bit of adrenaline that starts to circulate as we wake up. And I guess that's a minor stress, that is waking up and getting out of bed. I see that my fasting blood sugar might be 90, but it goes a little over 100 just by getting out of bed. And so the same with exercise. And again, that's the adrenaline effect as a part of the acute stress response. There's also a chemical called noradrenaline or norepinephrine that does very similar things. There's cortisol, which is part of the acute stress response, and cortisol will further increase our blood sugar, among other things. There's changes in our thyroid hormone, in something called gonadotropin releasing hormones. It's sort of one thing that does is the suppression of GnRH suppresses our libido. We don't need our libido to be in high gear when we're running away from a predator or what have you. So these are adaptive changes in the acute stress response. And we can also generate the acute stress response not just from running away from a predator or from engaging in a workout, but just by having certain thoughts, right? So I'm walking down the hall, I'm going to meet
Yeah.
with my chairman, or, we have some other meeting, or we're meeting somebody that we have some conflict with, or getting into any one of a number of potentially stressful situations. And just thinking about these things actually generates the acute stress response. That's okay. It's okay to have a stress response, even if it's not particularly adaptive, because it's making us jittery and our heart rate's going up and all of these other changes are taking place when there is no need to. This is just a thought of something perhaps threatening. It's not an actual threat. It's okay to experience that as long as we can bring those hormones, that physiology back to baseline quickly. And when we can't, we get into the realm of chronic stress. So these things that may be adaptive in the very short term, especially if there's an actual threat, are maladaptive in the long term. We don't want our adrenaline levels to be elevated chronically, because then we have chronically elevated heart rate, blood pressure, our heart's doing extra work. It's not good for our heart. We don't want our cortisol to be elevated chronically, because it suppresses our immune system and also further increases our blood sugar and predisposes to type 2 diabetes. And all those other thyroid, gonadotropin, multiple other hormonal changes, we don't want to have those on a chronic basis. For example, we don't want to have no sex drive if we're young and otherwise healthy, but that's a manifestation of chronic stress. So these are maladaptive changes. So how can we bring the acute stress response back down to baseline? In other words, neutralize that acute stress response when it's not adaptive, and avoid having it become chronic with all of these deleterious effects on our physiology and our health. And in fact, chronic stress induces changes that we see with aging. And so I would say that chronic stress actually ages us. It increases our biologic age. Obviously, doesn't increase our chronologic age, where whatever age we are chronologically, but chronic stress actually induces changes in our chromosomes and in our genes that resemble the aging process. In fact, they are the aging process. So, how do we bring the acute stress response back? How do we dissolve it? How do we bring those changes back down to baseline and avoid chronic stress? So, that was a very long winded way of explaining why personal resilience is important, because that's what we're talking about. If we want to bring the acute stress response back, to get rid of it, to bring these changes back down to baseline, that's resilience. That's the ability to cope with acute stress and prevent it from becoming chronic. And so that would be one definition of personal resilience, I guess, would be dealing with the acute stress response in such a way that we neutralize it. If we can generate acute stress with our thoughts, we can bring those changes back down to baseline and erase the acute stress response with our thoughts and with our actions. And so that is what personal resilience is. And that's really, I guess, my area of interest, is how to become more resilient and how to help other people become more resilient.
Okay, I love this because I think all of us, everybody listening, can certainly relate to both acute and chronic stress. We just live in these times, especially it seems more so recently. We've got there's been some changes in the world, just some political events, and now in this 24/7 news cycle, more and more of us are anxious and stressed, and we have this chronic stress, which is, interestingly enough, we're saying, hey, this chronic stress is going to increase our biological age. I think that is of interest to everybody listening to this. But I think that sets a perfect background for the rest of, or a foundation, I suppose, for what I really want to talk about, which is this moving into gratitude, moving into happiness, moving into joy, and the relationship. How do we move from this chronically stressed state over into this state of gratitude, this state of unstress, if you will? So let's start there. what are some tips for, you had mentioned briefly just some mindfulness, and you talked about these acute stressors could certainly be triggered just by thoughts of things and not say a being attacked by a predator. What are the first steps for moving in the direction of gratitude, moving in the direction of happiness, moving in the direction of joy?
Well, Kevin, I wrote a book called Gain Without Pain, and I'm not promoting the book. I'm just using that as an intro to
Sure.
explain the practice that I embrace and teach, and that we might call the gain practice. So I'll tell you what the gain practice is, and I think maybe that'll answer your question, and we can take a deeper dive into those elements, beginning with
Love it. Yep.
gratitude. So we get up in the morning, we open the blinds, maybe there's light, which is healthy for us when we're awakening. Maybe not. I mean, we're going into winter, so depending on what time you get up, it might not be light outside, but opening the blinds, having a look outside, doing our morning hygiene thing, and then finding a comfortable place to sit, hopefully a quiet place. Many people think that meditation means sitting still without scratching an itch, possibly in an uncomfortable position for 30 minutes at a time and banishing all thoughts from our minds. No, I mean, I can't do that. I wouldn't even recommend that we try to do that. But since some people think that's what meditation is, they decide, no, I can't do that. They never try it. Or maybe they try it and they fail. But in fact, I'm going to describe a 3-minute practice, a 3-minute meditation called the Gain Meditation. So here we are in the morning, sitting in a comfortable chair, and we first focus on our breath. So this is obviously the basis of most forms of meditation. We focus on taking a slow, deep breath through our nose, perhaps to a count of 3, pausing to a count of 3, and slowly, without effort, releasing the breath to a count of 4. And each of these counts might be 1 second. So the slow in breath, the pause, and the release is 10 seconds, 3, 3, and 4. And so our respiratory rate will drop to 6 per minute, 6 10-second respiratory cycles.
Mhm.
And by focusing on our breath, we're in fact doing a mindfulness practice because we're bringing our attention to the present moment. But in addition to that, we're changing our physiology. By taking slow, deep breaths, we're actually activating our parasympathetic nervous system. And the parasympathetic nervous system is that side of our, what we call autonomic, could be called the automatic, because it's sort of generally unconscious part of our nervous system that neutralizes our sympathetic nervous system. And when we were talking about acute stress, we're talking about activation of the sympathetic nervous system. Adrenaline or epinephrine is part of the sympathetic response. So the acute stress response includes activation of the sympathetic nervous system. And by taking these slow, deep breaths, focused breaths, filling our chest, filling our body, feeling our body expand, we're actually activating our parasympathetic nervous system. So our heart rate is slowing down, our blood pressure is settling down, we are settling down. And, this might be called the rest and digest process as opposed to the fight or flight process, which is the sympathetic nervous system. So slow, deep, full breaths. And we'll do that for a few cycles. And then we go to our contemplative meditation practice where we begin with, and I'm talking about 30 or 45 seconds each of these 4 elements, starting with gratitude. So we actually, while we're still kind of enjoying these slow, deep breaths, we contemplate that for which we're grateful. And we all have much for which to be grateful. We can get into this in more detail, but we all have hardwired properties of our brain, the neural connections in our brain that have developed through tens of thousands of years of evolution that bestow upon us a negativity bias and an inability to be present or a difficulty being present. So we often get up in the morning and our back is a little stiff, or maybe we have a knee that's bothering us, and we tend to focus on that. We get out of bed slowly, my aching back, and maybe we go into the bathroom and release that urine that's been stored in our bladder overnight. And we're ignoring the fact that our urinary system is working perfectly. The very complex mechanisms of our kidney physiology are working perfectly. Our kidneys are filtering our blood, getting rid of things that might be toxic if they built up in our blood, sending this liquid to our bladder to be stored so we can sleep overnight, even if we get up once or twice to empty it. The system is really in harmony, and it's a beautiful, elegant physiologic system, along with all the other elegant physiologic systems in our bodies. But the point is, we get out of bed, we ignore all the really wonderful things about the way our body is working, and we focus on the little negative things that we experience. Our fingers joints are a little stiff in the morning, our back's a little stiff, this and that. Let's be grateful for all of the wonderful ways in which our body is working miraculously. And I really do think it's a miracle. I think it's a miracle that we're born, most of us, in reasonably good health as a newborn, and that we're able to develop and grow. So we all have so much for which to be grateful. So back to the gain meditation, let's be mindful of that for which we're grateful, our body's physiology, that we have this day, as my friend Doug would say, on the right side of the grass. Let's be grateful for this day. Let's be grateful for the love that we have in our life, the friends and family that we have, the community in which we live. Let's be grateful for our relative health, even if it's not perfect. And we can all name a number of other things for which to be grateful. So we sit with this, we link it to our slow, deep breathing. We transition to acceptance, which is the A in gain, because we all experience pain and discomfort. The world does not comport with our apparent wants and needs. So this generates discomfort. And I lost my son at the age of 29, 6 years ago, and that pain is not going away, but I can work on acceptance. So I sit with my deep breath and I actually bring this experience, this feeling, this pain closer and closer. I feel my chest opening. I feel my heart opening. I bring this experience into my heart. I nurture it with my heart. I nourish it with my heart. I link this to my slow, deep breathing, and I just sit with it. I let my muscles relax. I feel my chest expanding as I contemplate and sit with this discomfort. And that's all there is to acceptance. There's a formula in the book: suffering equals pain times resistance. And acceptance is the opposite of resistance. So the more we accept that which is uncomfortable or that pain in our lives, the less we suffer. So we just sit with this acceptance. It sort of is in rhythm with our breath. We hold it, we sit with it, we relax into it. And we transition to the I in gain, which is intention. And as I said, our brains are wired in ways that appear to interfere with our ability to be happy. We have a negativity bias. We are constantly distracted by excessive thoughts, maladaptive thoughts of the past and the future. So if we want to be happier, we have to have intention. We have to have a plan to deal with these ways in which our brains are wired. And fortunately, our brains have this amazing quality called neuroplasticity. So we can actually change the way we think. And I'll give you a great example of that. One of my favorite examples is, and remember, I'm talking about a 3-minute practice, and we can go back to that, but I'm going into a little bit of a deeper dive into each of the elements. But there is a study that's ongoing at Duke. I believe it's still ongoing, but it had been or has been ongoing for years, called Three Good Things. So you can find it on the internet. Three Good Things, Duke University. It's the essence of it is that you can sign up to be a participant in the study online. You take a quality of life survey, which sort of documents your degree of happiness and unhappiness. And then you begin this practice whereby as you go to sleep at night, you think of three good things that happened during the day. So today, I think this evening when I go to sleep, I'll think, you can see the background, what a beautiful day it is here in California. That's a good thing. I met this cool cat named Kevin and was able to be on his podcast. That's a good thing. I'm going to take my dog for a long walk in the forest. That'll be a good thing. There'll be others, but those are three. So we think of three good things before we go to sleep. And what the investigators have documented in, I think, tens of thousands of individuals, that simply embracing this practice of thinking of three good things before we go to sleep improves the quality of our sleep, and it makes us happier. because it's rewiring our brain away from this negativity bias toward a more positive way of thinking. And again, these gain elements are interrelated. This is intention because it's a practice. We have to have intention to do this three good things practice. And it brings us gratitude because we think of three good things. And, of course, we're going to be grateful for those things and many others. So, this is an example of neuroplasticity that just by thinking of three good things before we go to sleep, which actually takes no time, we do this while we're, say, turning down the bed linens before we get into bed at night, we can actually begin to rewire the way we think. It's not going to happen overnight. Our brains have been wired this way over tens of thousands of years of evolution. So, but all we want is a process. Life is a process. There's no destination. Tiny baby steps every day. Three good things every evening. The gain practice every morning. This is the I of gain, the I that stands for intention or purposefulness or having a plan. We're going to have a plan to do the gain practice every morning, to be more grateful, to be more kind, to be more generous. This is our intention to do the three good things practice. We transition to the N in gain, which is non-judgment. And again, we are masters of judging everything in our environment and including ourselves. And because of our negativity bias, we often judge in a negative way. And this is especially true of self-judgment. So we tend to judge other people and the world in a negative light. It's our tendency to do that. We often sit down with a friend having a cup of coffee, and inevitably there's some whining about what's going on in the world and judging things. And, I don't want to get political, but I think, we snap to judgment. There's a great story about judgment that I love. It takes place in Manhattan on the subway. So the subway stops, in lower Manhattan. A gentleman gets on with 5 children, and they're, say, in ages from, let's say, 3 to 12. And the door closes, the subway takes off. The kids are sort of active and, pushing and shoving a little bit and having a good time and doing what kids do. And there's an older couple sitting across from them that's sort of looking at them and thinking, why can't this guy keep his kids in line, and, how disruptive this is. And there's a lot of negativity and judgment going on. And a couple of stops later, the door opens and the gentleman and his kids are getting off. And he looks at the older couple and says, we're just returning from my wife's funeral. I just don't know what I'm going to do. And they disboard the subway. And I think this is a really good example of judgment and how we often form quick negative judgments without knowing the context. And the context, as it turns out, doesn't really matter. There's no need to judge. We can discern, but we don't have to judge. Shall we get together for coffee with friend A, who's very positive and pragmatic, or friend B, who's whining and complaining and ungrateful? We can discern that we prefer to have coffee with friend A, but we don't have to judge friend B as a bad person. People are neither good nor bad. So this is judgment. So we might, in our gain practice, as we've gone through brief contemplations of gratitude, acceptance, intention, we might think of or picture a beautiful image of the Earth apparently suspended in space, one of these beautiful NASA images. And the Earth is a beautiful planet, but it's really intrinsically neither good nor bad. The Earth is just a planet. It's neither good nor bad. So it's only logical for us to think, I'm just a person. I'm neither good nor bad. I simply am the person that I am. And we picture the Earth. It's just a planet, neither good nor bad. And I am just a person, neither good nor bad. We can substitute someone else about whom we may form negative judgments. They're just a person. They're neither good nor bad. And then we just go to the I am, neither good nor bad, I am. And we refocus on our slow, deep breaths and do the focus on our breathing a few more cycles. And then we slowly open our eyes and we're ready to go out in the world. And even though I just spent way too much time talking about that without giving you a chance to intervene, and I apologize for that, but this is really just a 3-minute practice. Who doesn't have 3 minutes? So this is the way to answer your original question, I think, about how can we be more grateful? How can we become more personally resilient? It's to have a commitment to a daily practice, I think, is the best way to do that, even if it's only 3 minutes a day.
Yeah, so I absolutely love that idea of what you're describing there is almost bookending your day. You're going to start your day with this practice, this gain using this gain method, right? This 3 minute awareness or mindfulness practice, and you're going to finish your day with a gratitude practice. Basically, these three things. What did you say? These three. I'm going to identify three good things. And I think that what happens when we practice gratitude, I can remember doing a gratitude challenge. And I think it was something along those lines. I want you to do three things you're grateful for every day. But the trick was, and it's only for 30 days. Who couldn't do that, right? But the trick was you couldn't say the same thing twice during those 30 days. You couldn't be grateful for, you can't say I'm grateful for my wife every day, even though you might be, right? So you had to come up with three unique things. So as you might imagine, the first day is very easy. The next day is very easy. That first week's pretty easy. But what happens is you find this phenomenon of all of a sudden you're aware of, I guess, grateful opportunities. You're almost looking for things to be grateful for. You're walking around and you see a bird fly by and it's beautifully backlit by the blue sky or something. Oh, I need to remember that's going to be one of my grateful things for today. So you start looking for opportunities to be grateful. And to your point, I think that goes back to almost this neuroplasticity you were talking about. It's this gratitude's now rewiring my brain, and I find it fascinating the way you describe a negativity bias, because I think all of us can relate to that negative self-talk that we hear all the time. It's usually directed at ourselves, but you're right. We make judgment, right? We're not, most of us aren't in that non-judgment space. We're in that judgment space, and most of that is negative. Do you suppose, was that an evolutionary advantage at one point? Would that make me, way back when, just by having a negativity bias, more likely to survive maybe in a much more hostile environment? In other words, why are most of us wired in that way for the negativity, as opposed, why aren't we wired to be grateful, to be joyous all the time?
That's a great question, Kevin. I can tell you my answer to that question. I'm not an expert on evolution, but I can picture, I just gave a lecture at a holistic medicine or health conference in Los Angeles, and I used these images in my slides. So picture a family sitting around a fire in a cave, 75,000 BCE. And, the parents are taking care of their children. They're trying to keep the fire going. It behooved them to be rather negative and wary and think of the worst thing that can happen. So be a bit obsessed with thoughts of the future and negative thoughts of the future and sort of catastrophize. What's the worst thing that could happen? And there could be a saber-toothed tiger lurking outside the mouth of their cave. And then I change the slide, and there's the saber-toothed tiger in the image. I think if our forebears in a very hostile environment, as you correctly pointed out, were wary, we're always thinking of the worst, had this negativity bias, then it was a survival advantage, and they survived longer, they procreated more, they had more offspring, and these genes that code for these neural connections, these patterns of thought, if you will, were propagated in the population. And fast forward 77,000 years later, and here we are. And, we're stuck with these ways that our brains are wired, but they're no longer adaptive. I mean, some of them are more adaptive to some of us than others. For example, as a pediatric anesthesiologist and intensivist, it's good for me to think of the worst thing that can happen in a particular context. So I can plan for it, prevent it from happening, or if it does happen, at least I'm well prepared to treat it. I've got my syringes drawn up at the head of the bed in case, the surgeons do something to the patient that results in a drop in blood pressure. I can treat that right away. So perhaps these negative thoughts of this catastrophizing is adaptive in that very context for me, but I don't want to go home with those thoughts, right? So they're maladaptive most of the time, and for most of us, almost all the time, those thoughts are maladaptive. In fact, those negative thoughts the obsession with the future or the past. We obsess about the past too, and that generates a lot of regret, shame, low self-esteem, this imposter syndrome that affects so many otherwise successful people. These are maladaptive thoughts. And so they elicit the stress response, by the way, right? When you're going to the future and you're worried about something bad happening, you have a little release of adrenaline, cortisol, all those things. Your heart rate goes up, you get a little anxious, or even obsessing over the past and feeling like, oh, I wish I hadn't done that or said that. That elicits a bit of the stress response. So these are maladaptive thoughts, they're negative thoughts. And the good news, again, is our neuroplasticity. We can change the way we think, we can minimize our tendency to think this way. And by the way, for anybody who's listening, this is not your dirty little secret that you have this negativity, that you feel shame, regret, that you feel fear and anxiety when you obsess on the future. We are all wired this way. So please, take a few slow, deep breaths, activate your parasympathetic nervous system, and sit with this idea that this is the way we're wired, but we can change.
Yeah, that's a very hopeful statement. We can change. And as you're talking about this, and maybe in that historical, ancestral context of perhaps this negativity bias had served us at one time and serves us probably less so now, it occurs to me, it seems as if, let's just call it happiness, is on the decline. Does our culture have a happiness crisis? Is it maybe popular culture? Is it news media and media in general that would make me maybe think that? Or is that in fact a reality? Do you think, is happiness on the decline or is it on the rise?
That's a great question, Kevin. I think, you and I have been around for a few decades. I think, if we can kind of go back 30 years or 40 years, it seems as though the sky has always been falling, right? So we look at the double-edged sword of social media, everything that's happening in the virtual space. At one time we thought, I mean, this is before I was born and definitely before you were born, but when radio became a thing, I'm sure people were worried about, oh, people are not going to interact with each other anymore. They're just going to sit around the radio. And the telephone, same thing. People are not going to talk to each other in person anymore. They're just going to talk on the telephone. And then on and on and on. And here we are. But I do think, at least in my lifetime, I can't remember a more stressful period of time as the last several years. And it's just, there's so many things. I'm writing a book now about, it's called A Mindful Teen. And it's really about raising children and teenagers and first defining what all the stresses that they face are and how they are so negatively impacted and were by the pandemic and all these other things that are going, social media, shootings in school. Am I a boy or a girl? Should I wear a bulletproof vest to school? I'm being bullied online. What do I do about it? Is there going to be an earth to sustain my children and grandchildren? The sort of eco anxiety. So, for teenagers and for us, I think because we're worried about these same things. This morning I was listening to NPR and the House of Representatives is convening to try to elect a speaker. And it seems, what a mess. I mean, it seems futile. The Republicans are in the majority and they can't get together and support a speaker. So we're just in a state of standstill in our politics. And, our politics represent such deep division and even hostility. And so this and what's happening in Ukraine, what's happening in Israel and Gaza, just so many things, the pandemic, how we missed out on so many opportunities when we were living in a virtual communication realm, and how our kids missed out on their prom, their football games, their graduation, all of the other interactions at school, how we're trying to get our younger kids to actually learn online, which for an 8-year-old is almost impossible. So there's just so many things going on right now, Kevin. I do think This is really an unusually stressful time, and we've already talked about the relationship between chronic stress and our physiology, and I would just link that to happiness as well. When we're feeling the effects of chronic stress, it's very difficult to be happy. So, I hate to be too pessimistic about the future. Hopefully, things will right themselves in many of these regards. But I think this has been an especially challenging time, and one especially laden with chronic stress and unfortunately unhappiness.
It certainly seems to be that way, and I think that there's a bit of feelings of almost helplessness, right? I don't control anything that's going on in the world political stage, and with the pandemic and the all of these different things happening, and it can be a very disempowering feeling, right? And it can be a very stressful feeling for most of us. And I just feel like if if we can take these concepts that you were talking about, that, for example, your this gain method that you're talking about, if we can, we can't control what's going on, we can't control our stressors, let's say, but we can control how individually we react to them. Is that fair? I think that's kind of the message that we're saying here, right?
Absolutely. I mean, that's what the A in gain is. It's acceptance. It's again, these are age-old principles. As
Right.
the serenity prayer, for example, would have it, we need to discern between what we can change and what we can't change. And if we determine that it's something we can't change, that we're unhappy about, we need to focus on accepting it. And that's what we do in our
Mhm.
morning gain practice. And the interesting thing, Kevin, is just as in the Three Good Things program, the investigators found that after, I think it was 15 weeks of this practice, the participants had greater happiness for as long as they were monitored with these surveys, which was 6 months. So you get lasting benefit from this.
Yeah.
So
Right.
the A of acceptance, is really sitting with these things, discerning what we can change, what we can't change, and what we cannot change, we will hopefully have the wisdom to accept. But we have to be intentional about that because, again, our natural tendency is to be rather negative and resist things that we don't like. And that just exacerbates our suffering. But, as I said, the good news is we can change, we can become more accepting. And that's, in AA, they embrace the serenity practice and other useful practices. And I think this is something that we're all capable of doing. I think there's been well documented success with such a process in AA and other sort of treatment programs, if you will. And we can learn to accept. So we can learn to be happier.
We could learn to be happier. Yeah. So as we're talking about, you're talking about this accepting of things that we're not in control of, and having this very specific intention, not judging. And you've made a couple of references sort of to spirituality. What's the intersection between this happiness and this gratitude practice you're talking about and spirituality? And I'll just use that, just kind of the capital S, right? This sense that we're part of something greater, let's just say. We'll sort of leave religion and that aside, but just this more spiritual practice, is that inherent in what you're talking about? Is that something different? Is that a next level? How do you view that intersection between happiness and spirituality?
Wow, you ask really insightful questions, Kevin. I got to hand it to you.
Thanks.
Um,
Thank you.
I can only say that for me, embracing this practice and again, becoming more grateful, accepting, purposeful or intentional, less judgmental, it leaves me open to what is it I truly believe in a grateful, accepting, intentional, and non-judgmental way. So I think it sort of opens our heart to something greater. And so I think it can fit into the context of any true religious belief. For me, it's something called Advaita or non-duality, which is really kind of I would say, like a sectarian spirituality, if you will. But for other people, it can make them more committed to their Christian faith or their, you know, faith in Judaism or Islam or any one of a number of religious beliefs. But the, you know, the practice and what we glean from the practice is not religious, but I would say that it's spiritual in the sense that it really lays us open to seeing things as they truly are. And I think it's kind of hard to see things as they truly are and not believe in something much greater than ourselves, which is really what spirituality is all about.
Yeah, it seems to me that when you open yourself to this kind of a practice, you're getting just a little closer to, I guess we just call it divine reality, this higher sense of reality. We're getting outside of ourselves. And I mean, speaking personally, I can say that having a mindful, spiritual gratitude practice has been deeply, deeply impactful for me. I start every single day with prayer and I end every day with prayer. And when I say prayer, I'm incorporating, whether I realized it or not, I guess I didn't, but I'm actually incorporating pretty much everything we're talking about here. I'm definitely incorporating gratitude. I'm working on acceptance. I'm definitely very intentional about these things, and I'm on my non-judgmental journey, just like all of us are. We're somewhere on that path, right? And for me, it has been just a game-changing way of re-looking at the world and trying to make sense of why I'm in it. And it also is a big part of my purpose and my passion. I think that prior to having this practice, I was a little lost. I was just kind of going through, I felt like I was more going through the motions. And by slowing down, looking inward and allowing that to direct me outward, I just feel has made me a better, more purposeful human being. I don't know if any of that resonates with you or your journey or what you're trying to say here when you talk about gratitude and happiness and joy, but certainly for me, that's been my personal experience with it.
100%. I couldn't agree with you more. I have nothing to add to
Okay.
that.
All right. Well, fantastic. Well, how are we? Are we good on time? Do we have just a couple minutes?
Sure, we have a couple minutes.
All right, just very quickly then, as we're wrapping up, this will release right before the holidays. I'd love to, I think that we get a sense of where you're going to go here, but let's put a game plan together for the holidays because let's face it, for all of us, the holidays are stressful. Some of us, that's that quote unquote good stress. Hey, we're going to be traveling, we're going to be doing this, we're going to see the family members. But unfortunately, for a lot of us, that's going to be some negative stress. Family situations maybe aren't joyous for us, or we may have now politically divided families, or there's a number of reasons why the holidays could be stressful for us. What's our holiday game plan? What are we going to do here to get through this holiday? Let's do some damage control, but let's come out of it as better human beings on the other end.
I'm going to go back to the gain practice, and
Right
whether
on.
it's just the G, the gratitude, but I think all four elements really are intertwined. And what happens, Kevin, when we embrace this way of thinking and being is that we have light bulb moments. So I tell a story in the book where I'm do my gain practice, have a cup of coffee, get on my bicycle, and I'm riding to work. I'm very grateful to have a beautiful home on Stanford campus and have a short bike ride to the medical center where I work. I ride through this lane each day. It's part of my path on my bike to get to the hospital. And it's covered with a beautiful canopy of trees and earth. And, you know, I feel the soft surface of the earth, even on my bicycle, that I appreciate. I look at the light filtering through the treetops and think of just the absolute beauty. Oftentimes the sun is rising. It's beautiful. And then I'm riding along and I see another human being on the path walking in the direction in which I'm riding. And as I get closer, I realize he's looking at his screen and I'm thinking, God, this is such a beautiful place. Why is he looking at his screen? Then I get a little closer and I see that he's got earbuds in, thinking like, why is he isolating himself from this incredibly beautiful environment with the sun coming up and the light, you know, cascading over the treetops? And then a light bulb goes off and I realize I just did my gain meditation and the end is non-judgment. Here am I judging this person,
Mhm.
based on the fact that he's looking at his screen and he's got buds in his ears. And I have a laugh to myself. I actually get a little hit of dopamine, maybe a little serotonin, maybe a little oxytocin, these feel good chemicals, rather than that hit of adrenaline, which goes along with resisting what I'm looking at and judging it. And so as I ride past this individual, I look down at him and I smile, and he looks up at me and he smiles, and on I go. And so that was a light bulb moment, right? So when we really embrace these practices, whether it's just gratitude or gratitude, acceptance, intention, and non-judgment, we have these light bulb moments where we recognize, oh, I'm whining, I'm being ungrateful, I'm focused on my little bit of back stiffness as I get out of bed, and I can't stop thinking about why me. A light bulb goes off. I'm being ungrateful. Let's go to my gratitude for all the other systems in my body that are working perfectly, that I'm looking
Mm.
outdoors and I'm seeing trees and light, that I'm on the right side of the grass today. So we have these light bulb moments when we embrace these practices. So during the holidays, let's all have a series of light bulb moments. If we're stuck at the airport on the Wednesday before Thanksgiving, which so many people are going to be inevitably, or even the Tuesday before Thanksgiving, let's have the light bulb moment as we're whining about our circumstances and realizing we're going to be late. We have to wait 2 hours or 3 hours. Let's think of, we could be in Ukraine. We could be in Gaza. We could be having missiles exploding around us all the time. And here we are in a nice, safe, relatively comfortable environment with all these other beautiful human beings. Let's have that light bulb moment. We're sitting at a meal with family members, with some of whom we have a disagreement. Let's have a light bulb moment when we begin to judge and resist. Let's recognize that these are loved ones. These are just people. They're neither good nor bad, as I am neither good nor bad. And we have so much in common. There's love. Let's be grateful we're actually able to sit together. Let's be grateful that we're all alive together today. It beats the alternative. So let's just embrace these principles and let's enjoy the holidays, light bulb moments and all. And I think we can all be much happier and be present during these magical moments that we share with others.
I absolutely love that. Yeah, thanks for sharing that. And I think what occurs to me as you're saying that is, I think all of us, we all want the same things as human beings, right? We want to feel loved, we want to feel heard, we want to be happy, we want to know joy. And I just think that maybe the application or the roadmap to get there sometimes is a little muddy. And I think you've done a really good job helping to clear that up. And not by saying, hey, sit on a stone floor for 2 hours and chant Om, but by a very practical, this, hey, let's bookend our day with literally 3 minutes in the morning and 30 seconds at night of giving, you had mentioned those three things you're grateful for. So absolutely of all that. Well, Greg, as we're wrapping up here, I know you said you have a book coming out. You're working on your next book, but what else is on the horizon for you? What are you excited about here in the near future?
Well, I'm my book agent has a mindful teen book right now and is sending it out to
Okay.
publishers. So I look forward. I have to finish the book still, but I sent 5 chapters, so I'm working on that. I'm working on getting a mindfulness program into local high schools in the Bay Area, working with an outstanding organization in Oregon called Peace in Schools, and two organizations on the East Coast as well. So I'm committed to that. I am retiring from my clinical practice. I'm at an age which doing cardiac anesthesia and intensive care for babies and children with congenital heart disease is something perhaps better left to the younger crowd. I've got a lot of capable people filling in. So this gives me more time to spend more time here in Carmel, where I have a second home. And I'm very, very grateful for that. Focusing on my physical and other fitness and doing more speaking, which I am doing. I've got speaking engagements all over the place, maybe a little much right now, but because I came back from Istanbul and New York and Los Angeles, and I'm going to 3 places in Japan and Hong Kong in a couple weeks. Yeah, so it's busy, but not excessive, and I'll just sort of keep the ball rolling and again focus on the present moment, and then just see what unfolds. Uh, with some degree of anticipation and positive outlook. And, we'll try to keep all these things going moment by moment.
Fantastic. All right. Well, people are listening here and they want to connect with you, maybe learn more. Where would you like to send them?
I have a website, greghammermd.com, GregHammerMD.com. I think there they can find the first book and lots of other media. Probably our discussion will be on there at some point soon. And yeah, I think that's a good way to link up. I know there's other links on there and ways to get a hold of me or my publicist.
All right, fantastic. And folks, I will put all of Greg's information into the show notes. You guys can find that there. Greg, I want to thank you so much for coming on the show today and just sharing your story, your passion, your love, and your message with us. I think the work you are doing is so vital, especially like we mentioned for our times. I just really encourage you to keep up the great work.
Likewise, Kevin, I love your show. I've absolutely loved this conversation we've had, and I look forward to connecting with you again.
Okay, that's our show for today, folks. If you've enjoyed this podcast, I want to let you know that we have other free resources over at silveredgefree.com. There, you'll find our free guides with our top tips on nutrition, exercise, and healthy lifestyle to assist you in your weight loss and fitness journey. So feel free to head over there and download anything that looks useful to you. I'll put links to everything we talked about in the show notes, and you folks can find those over at silveredgefitness.com/242. As we wrap up our time together today, you can show your support for this show in two important ways. The first is to tell a friend about this podcast and encourage them to give it a listen. The second is for you YouTube folks to click the like and subscribe buttons, and for you podcast folks to please give this podcast a 5-star review on whatever platform you listen to podcasts on, and be sure to subscribe and follow so you don't miss any future episodes. I really appreciate you spending your time with me today, and until next time, stay strong.